Hello and welcome to News Central Now, coming to you live from our studio in Lagos, the economic capital of Nigeria. I am Gbenga Aborowa, and here are the top stories at this hour. Survivors of Mozambique militant attack ferried to safety. Nigeria's electoral umpire to capture new voters ahead of 2023 general elections. And confirmed COVID-19 cases in Africa surpass 4.2 million. We'll bring you all the details shortly. About 1,200 people displaced by last week's attack by militants in the northern Mozambican town of Palma have disembarked in the city of Pemba. They were transported to Pemba on a boat chartered by the French oil and energy company Total. The displaced people, mostly women, children and the elderly, left the boat earlier today after screening to check for infiltrators from the insurgents. It's the largest single arrival of displaced civilians from Palma to a location outside the conflict zone. Thousands of people gathered at the port to check if relatives and friends were amongst those who had arrived. Now, West Africa resident doctors in Nigeria have embarked on an indefinite industrial action after the deadline they gave to the federal government to meet their demands expired on March the 31st. Amongst the grievances of the National Association of Resident Doctors against the Nigerian government was a non-payment of allowances. On Wednesday, a government-led delegation by Labour Minister Chris Ngige met with the doctors to avert the strike. The minister appealed to the aggrieved doctors to consider the damage their withdrawal of services would cause the country's health system, already stressed by the coronavirus pandemic. Now, joining me this evening to discuss this is Dr. Chukwujama Ejiofor, the second Vice President of the National Association of Resident Doctors. Thank you very much for joining us on the news, Dr. Ejiofor.
Good evening. Thanks for having me.
Now, what's the reason behind this latest strike by the National Association of Resident Doctors?
Okay, thanks for the question. I don't think it's a new reason. I really don't think it's a new reason. It's been the old reasons of why we've been agitating for better welfare. And in this particular occasion, a large chunk of our members around the country were not paid for 3 months. And these are the youngest doctors in the clan. And we had appealed to government severally, and nothing was done about it. We had an ultimatum which ended yesterday, being the 31st of March. And the government did not meet up with what we asked them to do. So we are back on a strike.
So, understanding the current nature of that the world is in the midst of a global pandemic, we're dealing with the coronavirus, and knowing this and the meeting that was held yesterday between government and officials of your associations, wasn't there a sort of common ground resolution that could have happened to avert this strike?
Well, there's an organogram for the association. Apart from the National Officers Committee, we have the expanded National Officers Committee before we now get to the Executive Council. And the National Officers Committee met with government yesterday. First of all, I would like to say that an ultimatum that was given since January, with communiques written, with yet another Executive Council meeting, with yet another communicated to the government, and it took them all this while before they called us a day. On the day the ultimatum was even meant to expire from that, and which was not so nice and it wasn't tactical enough.
Now, Dr. Ejiofor, what's the government saying? Are they asking for more time? Are they saying some of these demands are unreasonable? What's the government's position?
No, the government's position is they offered solutions to the problems we came at them with. And this has been taken to the expanded National Officers Committee, of which a meeting held this evening by 6 p.m. And the outcome of the meeting was a unanimous disagreement with the government, and the strike continues because we haven't really gotten what we want from government, with the hope of having the strike end with better conditions for doctors and for Nigerians in general.
Now, finally,
So as we are right now, the strike continues.
Now, finally, this is not the last, this is not the first time that doctors have embarked on an indefinite strike. And what, in your opinion, could be a solution to this? We do know that a lot of your grievances are genuine, and we know the importance of our healthcare system is already stretched. So when you have a situation where resident doctors are going on strike, it doesn't augur well for the country at large. What, in your opinion, could be the solution to this so we don't have on and off strikes?
Okay, thank you very much. That's actually the kind of question I love answering. First of all, the government, like I had said in previous interviews, the government knows exactly what it has to do in trying to heal the health sector. We have a lot of arrears of members still on pay. We're going through a time of COVID-19. Everybody in Nigeria is a potential patient, including you and me. In fact, I've actually suffered COVID-19 twice, being one of the frontline personnel that work in the COVID-19 center in UNCH Enugu. Anybody can fall ill at any point in time. But despite all this, we have, for many years, had our hazard allowance pegged at 5,000 naira for every health worker. Now, this 5,000 naira is not even enough to buy a packet of Augmentin, which is an antibiotic, which people use around. I mean 5,000 naira a month. And this is the same country where people in office get 1.2 million for poverty allowance. We have to know who is important in this country. Nobody is more important than the other. Thirdly, apart from the arrears, there are a lot of other problems. The Medical Residency Training Act, which is a law in this country, is yet to be implemented. So I'm wondering why something that was formulated in 2017 up until 2021, it's yet to be implemented. Our colleagues are dying every day.
Thank you very much, Dr. Chukwujama Ejiofor. I wish we could go on, but we're fast spent for time. I do appreciate your insights on the subject, and I hope a solution will be found soon. We'll definitely keep up to date with developments and get back to you as soon as we need to. Thank you very much for your time.
Thank you for having me. Have a lovely day.
Nigeria's electoral umpire is set to register new voters ahead of the 2023 general elections. The chairman of the Independent National Electoral Commission told newsmen in Abuja, the federal capital, that the commission has commenced building an online registration portal that will ease the process. The portal is also aimed at ensuring that those being registered keep to COVID-19 safety protocols.
There are three cardinal reasons why the exercise could not start earlier. The first is the establishment of new systems that would ensure safer CVR exercise in the context of the COVID-19 pandemic. In this regard, the Commission is building a new online registration portal that will enable new registrants to commence registration online and subsequently complete the capture of their biometric data at designated registration centers. This is designed to reduce overcrowding. Through the online portal, they can schedule their visits to the registration centers to suit their convenience.
With Nigeria's general elections barely 24 months away, a former governorship candidate of the country's ruling party, the All Progressive Congress, believes the party has done well enough to deserve another term during the 2023 presidential elections. Peter Said contested for governor in the southern state of Rivers in the 2015 election, but lost to incumbent governor Nyesom Wike of the People's Democratic Party. He criticised what he described as the inability of the PDP-led government to provide infrastructure in the state, promising that the APC will do much more when it takes over Rivers State in the 2023 elections. As the Nigerian government declares Friday, the 2nd of April, and Monday, the 5th of April, as public holidays to mark this year's Easter celebrations, Nigerians have expressed their concerns about travelling during this holiday period. COVID-19 restrictions and the recent spell of insecurity on Nigerian roads, amongst others, have been the major reason why Nigerians say may hinder their travel plans. News Central's Omolola Ololade went round some major motor parks in Lagos, the country's commercial capital, and filed this report.
Traveling during the holiday is something we all look forward to, as it helps to ease stress and feel refreshed. With Easter around the corner, it is another opportunity for some Nigerians to travel. But these Nigerians express their grievances about traveling at this critical time.
We're here live at Jibowu, one of the busiest parks in Lagos, Nigeria. You're trying to find out what the state of things are because, as you can see, enough activities are not going on compared to what it used to be back in the days, especially as it is Easter period. Let's find out what people are saying concerning traveling this period.
No passengers. I had to go to like 3 parks today just to get a vehicle that will take me to Abuja at least, if I can get one to take me to Kaduna. So yeah, those are the things that have changed from last year that I traveled this year.
It will be recalled that many Nigerians could not travel this time last year, as some states in the country were on a total lockdown due to the COVID-19 pandemic. However, the situation of things may have improved as regarding COVID compared to last year. Road users, however, complained bitterly about other things.
Most of the challenges we do face, one is the bad roads. One, if the roads can be fixed, that will help a lot. And also insecurity. People are scared that they don't want to travel by roads anymore. So whenever they manage to travel, they will keep, pushing the driver, to move fast, to speed,
I think the rate at which people are traveling now is lower to be compared to last year. And I will say because of the COVID-19, then there's this current issue going on in the country now. That's the issue of the herdsmen, which they are maybe like around the north central part of the country and few parts of the southwest of the country too. So let me say people are just scared for their lives. So the safety in this country is no more assured.
The threats on the highway now is getting too much. Money is not in circulation. Parents hardly feed their children, not to talk of to have extra to go to the village and spend here and spend there. Terrorists on the highway. People are scared to move.
No matter the situation, it's a hope that COVID-19 restrictions will be observed and traffic rules obeyed so as to ensure safety on the roads and during the short holiday.
Meanwhile, 60 suspected cultists have been arraigned in courts by the police in Lagos and Nigeria's southwest under the new anti-cultism law recently passed by the state governor Babajide Sanwo-Olu. The law is part of the state government's effort at curbing the rising tide of cultism in the state. News Central security correspondent Chukwujama Ejiofor was at the court during the proceedings, and she brought back this report.
The anti-cultism law signed by the Lagos State Governor Babajide Sanwo-Olu on 16th March 2021 has taken effect in Lagos, southwest Nigeria. The new law prescribes a 21-year jail term for convicted cultists in the state. 2 days after Governor Sanwo-Olu signed the bill, Ikosi-Ketu turned into a war zone as rival cult groups reportedly clashed. On Wednesday, the Lagos State Police Command arranged 60 suspected cultists arrested at various communities in the state to the Chief Magistrate Court in Yaba before Chief Magistrate Adeola Adedayo. The police prosecutor filed a 13-count charge against the 60 suspects of various offences, including conspiracy, murder, cultism, unlawful possession of firearms, and breach of public peace under the new Lagos State Anti-Cultism Law 2021 and the Criminal Law of Lagos State 2015. The new anti-cultism law provides that, on conviction, cult members risk a jail term of 21 years, while their parents risk 2 years imprisonment or a fine of 500,000 naira, and the landlords could be jailed for 15 years for aiding and abetting. The police public relations officer, CSP Olumuyiwa Adejobi, while briefing the press after the arrangement, said the new law is a catalyst in eradicating cultism across the state.
We have 48 male suspects and 12 female suspects. The arraignment is on. You can see it's batch by batch. And of course, the command is very happy to have this law because it's like a sigh of relief to us in the command. The new law has taken care of certain loopholes in the previous criminal laws pertaining to cult-related matters in the state. So it's a plus to us in the command. It's a good achievement to us in Lagos State Police Command. And this is a call for everybody, all stakeholders in security business in Lagos State, to know that this law is on ground and is going to be adequately enforced by the police and other prosecutors.
The Lagos State Police Command had changed division police officers and other operational units within the state in order to rid the state of cultism and other social vices in different communities.
For us, this is what we want to do more. We want to be more proactive. We want to be involved in more preemptive strikes. And we want to work with citizens to ensure that we're able to take down these criminals before they commit a crime.
You are to News Central now. Coming up on the news, confirmed COVID-19 cases in Africa surpass 4.22 million. We'll bring you details of this and more when we return. And now to continue the coverage of the coronavirus pandemic across Africa. The Africa Centers for Disease Control and Prevention, Africa CDC, says the number of confirmed COVID-19 cases in Africa has surpassed 4.22 million as of Thursday afternoon. The Africa CDC said the death toll from the pandemic stands at 112,820, while 3.77 million patients across the continent have recovered from the disease. The African continent accounts for 3.3% of total COVID-19 cases reported globally. The Africa CDC also said COVID-19 related deaths in the continent account for about 4% of all COVID-19 related deaths recorded globally. South Africa, Morocco, Tunisia, Ethiopia and Egypt are amongst the African countries with the most cases in the continent. The 5 countries account for about 65% of all cases reported in Africa. Meanwhile, the Africa CDC has blamed supply delays from a key Indian manufacturer in case it's unable to meet its targets of vaccinating the continent against COVID-19. Africa CDC Director John Nkengasong today told the press briefing that officials hope the problems at the Serum Institute of India will be temporary. More than half of the 29.1 million vaccine doses received by African nations so far have come through the COVAX global initiative. In the meantime, the Namibian government has welcomed the move by the African Union to seal a vaccine supply agreement with Johnson & Johnson. The vaccine would be manufactured in South Africa and distributed to all 54 member countries. Namibian Minister of Health and Social Services, Kalumbi Shangula, described the AU vaccine initiative as coming at the nick of time. The initiative will see the manufacture and supply of 400 million doses to all countries in the continent. Shangula said this will greatly assist the push to achieve herd immunity. Now, with the Easter weekend approaching, South Africa has warned that police would be deployed in the streets to deal with people not adhering to COVID-19 regulations, especially regarding alcohol. Briefing the media today on the updated regulations, Cooperative Governance and Traditional Affairs Minister Nkosazana Dlamini Zuma said police roadblocks will be set up. People would not be allowed to buy alcohol at retailers, but while establishments, including restaurants and bars, will sell alcohol, patrons will not be allowed to take it home. Dlamini Zuma said the decision to ban alcohol over the weekend is to curb the spread of the virus, which resulted in high levels of hospital admissions in December. Algeria today reported 112 new COVID-19 cases, raising the total confirmed number in the North African country to 117,304. The Algerian Ministry of Health said the death toll from the virus rose to 3,096 after 3 new fatalities were added. The ministry said 94 more patients recovered from the disease, bringing the total number of recoveries in the country to 81,632. A donation of Chinese Sinopharm vaccines arrived in Algeria on February the 24th to help combat the pandemic. Now, WorldRap, the World Health Organization, has criticized the rollout of coronavirus vaccines in Europe as being unacceptably slow. It also says the situation in the region is more worrying than it has been for several months. Vaccination campaigns in much of Europe have been hit by delays and the number of infections is rising. France is the latest country to announce new lockdown measures lasting 4 weeks. WHO Director for Europe, Hans Kluge, said the rollout is slow and prolonging the pandemic in the wider Europe region. He said as long as vaccine coverage remains low, EU countries would have to impose lockdowns and other measures to compensate for the delays. Rights organization Save the Children says at least 43 children have been killed by armed forces in Myanmar since February's military coup. The group said the Southeast Asian country was in a nightmare situation with the youngest known victim just 6 years old. A local monitoring group puts the overall death toll at 536. The UN envoy to Myanmar has warned of the risk of an imminent bloodbath as the crackdown intensifies. The warning follows a flare-up in the fighting between the army and ethnic minority militia in the border areas. The unrest in Myanmar began 2 months ago when the military seized power after an election which the National League of Democracy Party won. And in business, global acceptance of cryptocurrency grows, it is expected that countries will create their own digital currency to back up the traditional tender. On Business Edge, Ola Atose, founder and CEO of CoinCoin, a cryptocurrency exchange, sheds more light on this. Okay, we'll bring you that in subsequent bulletins, but that concludes the news at this hour. But before we go, let's bring you a recap of our top stories. About 1,200 people displaced by last week's attack by militants on the northern Mozambican town of Palma have disembarked in the city of Pemba. Nigeria's electoral umpire has reiterated its resolve to capture new voters ahead of the 2023 general elections. And the African Centers for Disease Control and Prevention, Africa CDC, says the number of confirmed COVID-19 cases in Africa has surpassed 4.22 million as of this afternoon. Remember to follow us on social media with News Central TV. You can also catch up with our news and programs. Just download the News Central TV mobile app on Play Store and iOS. You can also watch us live on StarTimes channel 274. Many thanks for watching. I am Gbenga Aborowa.